This presentation is brought to you by the Beljanski Foundation. Over 50 years of research towards curing cancer the natural way.
Thank you. So I want to talk to you today about something that's very near and dear to my heart. I actually have autoimmune Hashimoto's. Mine was engendered by mold exposure, but really any type of infection, whether it's from the GI tract or the oral cavity or something external like mold, can cause autoimmunity. So today I'm going to talk to you a little bit about how autoimmunity happens and what we do with Bio-Sidin. How many here have ever heard of Bio-Sidin? Okay, a couple of you. So good. So this is new. I'll tell you the story of Bio-Sidin. So I was just getting out of acupuncture school 30 years ago and had been working with patients that had immune system disorders. And one of the doctors that I was giving the herbs to sent the Bio-Sidin formula to a lab called Genova Diagnostics. And they tested it and they found it was the most effective natural substance to treat yeast and bacteria, and they wanted to put it on the panel. And I said, sure, you can put it on the panel. Well, little did I know that 30,000 doctors a month are going to be hearing about this herb formula and that they're going to be wanting it. So I call myself the accidental CEO because I had no intention of starting an herb company, but that's what happened 30 years ago. So I've been working with infection and working with doctors who are doing functional and integrative medicine for 30 years and training them how to use botanicals. So I'm really happy to talk to you today. So Bio-Sidin works, kind of across the board as nutritional support when you're addressing any type of infection, whether it's yeast or bacteria or parasites or viruses, and whether that's in the GI tract or systemically, and in the oral cavity. We've done year-long Lyme research projects and found that the botanicals were incredibly effective in addressing Lyme. This was in vitro, so not in patients, but in the Petri dish. But we see that it's, killing the Lyme spirochetes, it's breaking the biofilms, it's stopping the Lyme from going into a persister stage. And it's also helping antibiotics to work better. And the reason it does that is it breaks biofilms. We've done studies on small intestine bacterial overgrowth and other things. A lot of children with autism use the Bio-Sidin. We'll talk about that in a minute. But basically, the microbiome in the gut is kind of the linchpin of all diseases in a way, because if your GI tract is disordered and you get these particles of foods or particles of bacteria or endotoxins from the bacteria into your circulation, your immune system starts overreacting. So for example, I had a patient whose lab test showed up 4+ Klebsiella bacteria. The only symptom she had was 20 years of rheumatoid arthritis. We addressed the Klebsiella. 8 weeks later, run another test, no more Klebsiella, and lo and behold, no more flare-ups of RA. So I said, let's continue. Let's do 4 to 6 months of treatment. And then, again, let's check your labs. Still clear. To this day, it's been 2 years. She has not had another flare-up of RA. So that's a really simplistic case, but sometimes that's just as simple as it is. You've got particular bacteria. It's translocating outside of your gut, setting up shop in a joint someplace, and now your immune system is just like sending little machine gun signals of cytokines and creating this massive inflammation. So anywhere in the body, things like fibromyalgia, when bisected a muscle, they have found these endotoxins just riddled into the tissue. And so you can imagine that's what's causing all the pain. And when you address the gut and the mouth, and you stop this leakage of these bacteria and toxins into your system, lo and behold, these things clear up. Diabetes, thyroid problems, and so forth, they all can have a relationship. So here is a nice little map of some of the tissues that are affected. How many people here are affected by autoimmune disease or know somebody who is? It's quite a few of us. And I think not only are we dealing with our leaky gut issues, but we're dealing with environmental toxins, right? We're dealing with stress. A lot of things are coming together at the same time in our current time and lifestyles. So here's something that was published showing that this dysregulation of bacterial communities leads to inflammatory disorders, including SIBO, inflammatory bowel disease, obesity, diabetes, and autism. So I think that although this is known in the medical literature, and you can look this up on PubMed, standard Western medicine is not really addressing this issue. They're just giving steroids. They're masking the symptoms of the inflammation, but they're not going for the root cause, which could be a pathogen in the gut, leakage from the mouth, or something like mold exposure. And here's another study that showed that the factors like infections and toxins in the environment and things like gluten and casein in some people are what's starting the autoimmune diseases. And if you're really interested and kind of geeky, you can look up the work of Dr. Aristo Vojdani. And he was the one who really showed the etiology of autoimmune diseases and what happens with gluten, for example. And he's able, with his lab, Immunosciences, to find markers 10 years before you have a symptom of autoimmune disease. So it's worth working with a functional or integrative doctor and getting testing done, because part of your health program, just like the previous speaker was saying, looking at stem cells and looking at our diet as part of rejuvenating our system, I think that getting proper lab workups is a good idea. This is a slide that shows you how many people here have heard of leaky gut. Oh, most of you guys know. So that's what it looks like. You've got these, tight junctions in the gut, and they're like shoelaces. And when you're exposed to gluten or casein, or you've got glyphosate, which is Roundup, on your non-organic food, there's so many reasons. Splenda causes lysing of that. You end up getting these particles into your bloodstream. And, here's another study showing that neurodevelopment in children and adults can be affected by leaky gut. So one of the things I've worked with a lot over the last 30 years are children with autism. 100% of children with autism test positive for yeast and bacteria loads that are higher than normal in their gut. Most of those kids also test positive for heavy metals. These kids are probably genetically predisposed to not being able to excrete toxins well, and they may be genetically exposed to have a lower immune response. But certainly they all seem to be affected by dysbiosis in the gut, and they all seem to have yeast and bacteria. And what happens is that these chronic infections cause the nerve cells in the brain to be chronically inflamed. Just like in RA, that inflammation is in your knee or your hands. Well, in these children, it's in the brain. So cutting down on the load of bacteria and yeast is really important. Cutting down on anything in their diet that could be inflammatory is very important. So the Bio-Sidin, we started out with just this liquid formula, which is what we use for treating the GI tract and addressing nutritional support there. And then we ended up wanting to use a liposomal format to bypass the digestion and go directly to the bloodstream. And so when health practitioners are using it as support to address Lyme disease, for example, or MS, or an infection like in the prostate or UTI or in the lungs, outside of the GI tract, we use the liposomal format, and then we put it in the oral care products. We also have a throat spray version, and we did a study on that one. I'll show you in a sec. So this was the publication of that study. A university in Louisiana had elite athletes that showed compromise to their upper respiratory immune system when they exert themselves strongly. So they exercise too hard. They're either football players or marathon runners or whatever. And when you measure the immune system in the saliva, it's suppressed. But by adding the Bio-Sidin throat spray 10 minutes post-exercise, they got 66% improvement in their immune response. So that just kind of goes to show you that the herbal medicine can really help modulate your immune system. It'll help protect your upper respiratory tract, your mouth in terms of your oral microbiome, and your gut. So these are the various things, again, that we've been offering to the doctors. And the support products we use, because when you're breaking a biofilm, which is the covering that the bacteria and viruses and parasites produce, you're going to release those toxins into the system. So it's really important to mop up or bind those toxins and get them out. How many people have heard of die-off reaction or cleansing reaction? A lot of you. So you'll know that if you take something that's killing off the bad yeast or bacteria in your gut, you might feel tired or dizzy, or you might have digestive changes, headaches. You might be having changes in your sleep. And that's because your body's suddenly having to deal with the toxic burden of those byproducts. So it's really important to bind those things, and that's why I put together the GI detox formula. So you bind those toxins and then you get them out of your system before they have a chance to hurt your organs and make you feel bad. And that's a really important part. The other thing that's really important to do is to address your beneficial flora. And what I found over the years is that most regular types of flora, the acidophilus and bifidus types of products, they have to be refrigerated. If they're not, they can lose their potency. They're affected by your stomach acid. Only about 1% of them actually make it to the GI tract. So, the bottle you're paying for, $35 or whatever, for a good flora, you're not getting a whole lot out of it. So I wasn't super happy about that. And what I found was that the spore-forming probiotics, which are soil-based organisms, are something that we used to always get in our food. We'd farm, we'd eat things out of the ground, and you'd get a little dirt, or you'd be touching dirt during the day, or you'd be touching farm animals during the day. But here in the city, we don't do any of that. We don't get exposed to the normal dirt that we used to. And so the soil-based organisms help replace that effect. And they're not hurt by stomach acid. They don't have to be refrigerated. You can use them with an antimicrobial like the Bio-Sidin, because the Bio-Sidin won't kill it. So basically, they're the perfect probiotic to use in a situation like this. And thinking about what most people are dealing with inflammation related to autoimmune disease, related to gut dysbiosis. And so I added a pharmaceutical-grade quercetin that's 170 times more absorbable than your typical quercetin you would get at the store. And the reason I did that is that, these are professional products. These are used by doctors, and we really want to use things that are going to make a big effect. So 1 pill a day of the probiotic with that 100 milligrams of pharmaceutical quercetin in it and the aloe and marshmallow to heal your gut is all you need, and you see a huge change in allergies, in bloating, gas, any of the problems that you used to have in your gut just get calmed down. I myself used to be very allergic to grasses, and I have horses, and so if I would feed the horse and I would grab the flake of hay, I would get hives on my arms. Since using the ProFlora every day, I just put it in my little pill container with the others, no more allergies. So I'm super happy with that, and I think that's a really useful one as well. And the other product that we have as a support is called Biotonic, and that's a Chinese herb formula to really strengthen and boost your immune system and boost your digestive system. So those are the support things that we use along with Bio-Sidin to kind of round out a program for people. Yep. No, it's not moving. There it goes. Whoops. Go back. So we have 2 different programs that the doctors like to use for their patients. We have a 1-month cleansing program that you get the Bio-Sidin and the GI Detox and the ProFlora. And that's just a simple kit. And it's discounted 15% over the regular prices so that it makes it more affordable for people. These aren't very expensive anyway, really, when you consider what they're doing. And then we have a 2-month kit that has some other formulas in it, the Olivirex and the Biotonic, and that's for people who maybe have been chronically ill for longer periods of time, maybe have something like Lyme disease, or been very sick and need more support. So that gets them through 2 months, and then they can check again and see how they're doing. Typically, people will feel better within 3 weeks, like major changes in their energy and their digestion when they're using something like this. Of course, you have to have, as much as possible, a clean diet to really support your healing. But if you do cheat once in a while, at least it's not the end of the world. If you eat a piece of cake and you're on the Bio-Sidin, your candida is not going to go through the roof, But in general, we tell people to have a low glycemic, anti-inflammatory type diet when they're doing this kind of healing. So leaky mouth, I mentioned. The American Heart Association has said that 50% of cardiac events are caused by dental bacteria. 50%. And now they're finding these same dental bacteria in Alzheimer's. So there's a huge correlation between what's going on in the mouth and what's going on systemically. Think about it, you're swallowing several liters a day of saliva. And if those bad bacteria are in your mouth and they're getting into your gut, you're just reseeding this whole problem of intestinal dysbiosis. So that's why I thought it would be very useful for people as part of their program to go ahead and put the Bio-Sidin in a toothpaste and in an oral solution and started dressing the mouth. I had no idea how effective that was going to be when I came up with this. And what we saw was incredible. I'll show you in a minute what the lab tests look like. So here you have before and after. This is in a root canal cavitation. So the dentist went into the cavitation, pulled out a sample of the bone, sent it to a DNA lab. This whole list of bacteria, including things like HPV. You don't want that in your mouth, right? Amoebas and all these bacteria. And then after 8 weeks of treatment, just much less bacteria. And every single patient that was studied went from like 35 pathogens down to between 3 and 5. And so now we're going to do a larger double-blind placebo-controlled trial on this, but this was the pilot study. The other thing we see is the plaque on the teeth themselves goes from unbelievable to nothing. And I have a video. I'm going to try to see if it'll play. Let's see what happens. I don't know where the guy is. Oh, he left. Well, you know what? If you want to see it, you can come by my booth. It's on the stick, but I'm not sure how to get back there. So I've got a video of a dentist who took a film of a patient's pocket, and you see all these bacteria swimming around. You see rods, you see spirochetes, you see amoebas. And then she put the Dental-Sidin solution on there and then immediately videotaped the same area, and everything is dead. And she said that they have used in their office gentamicin, bleach, hydrogen peroxide, ozone, every type of normal antipathogen that dentists use, and none of them worked like that. And so because of that, she's going to come on board as advisor. She was the keynote speaker of the American Dental Hygienists Association last year. And so she really wants to get this out to all the hygienists that you could use these botanicals and successfully get rid of the bacteria in the mouth. The dentists are reporting that the pocket probing depth is coming down 50% within 2 to 3 months. So if you went into the dentist, you know how they're measuring, they do the little thing and they say the numbers, and you've got numbers that are up in the 5s and 6s, you're a candidate to get root planing, which is incredibly painful and expensive. The dentists are telling me that if patients start doing this, that they can get out of having to need root planing. So that's pretty huge, right? So my mission has now become to really take these dental products more to people everywhere. And so starting in February, I'm launching a new company to make this possible called Hygeia. Hygeia was the goddess of preventive medicine and hygiene. So doesn't that sound good, Hygeia? It's like, yay, goddesses. And so starting in February, I'll have Hygeia available, and the Hygeia line will include a special sonic toothbrush that has a little probe that you can go between your teeth with the oral solution. And we also are going to have a probiotic mouthwash. And the probiotic mouthwash is amazing because it's got the throat spray that raise the immune system and those spores for your microbiome. So you'll be able to spray that in your mouth after eating and keep your mouth modulated throughout the day in between brushing your teeth. So I think I've got a winner system. What do you guys think? Is it going to work? Yes. So I think we've come to the end of our time just about.